Many years ago, when I was a second year resident in pathology, an incoming resident asked me, how can I be the best at residency during my first year? I gave that person some tips based on my knowledge at the time. However, with time, I have thought a lot about that question and eventually created this brief presentation. I hope this will be helpful in your journey through the pathology world. I will start off by talking about how to prepare for residency, what are different parts of residency, some useful tips from experienced pathologists, and finally, resources that you can use as a newly minted pathology resident to enhance your experience and knowledge. When you start your residency, be ready for what is coming for you. It is going to be hard, and you will feel lost at first. Residency is very different from medical school, and the transition is a big jump. You should keep an open mind about your future career. Try to rotate in a subspecialty before making your mind up about it. Try to lead a little bit every day. As hard as it sounds, try to be professional because pathology is a small world and word travels very fast. Join pathology societies, go to their meetings, meet other residents there. Before you start your residency, or as soon as you start it, try to review normal histology. I will mention a few books that you should read as a beginner when starting your anatomic pathology rotations. Let's review some standard components of a pathology residency. Broadly, pathology is divided into anatomic and clinical pathology. Anatomic pathology involves dissecting tissues or organs and looking at cells under a microscope. Clinical pathology deals with running a lab and overseeing the different components of a pathology lab. Hematopathology is a unique specialty as it involves both anatomic and clinical aspects. These are components of a standard 4-year APCP residency. However, there are variations to this theme as well. As a pathology resident, you can choose 4 different pathways for training. Most people choose Path 1, a combination of AP and CP, which takes 4 years of training, and you have to take AP and CP boards. Some people prefer choosing only AP or CP, and they finish their training in 3 years and take the respective board exam. Some people focus on AP in neuropathology, especially if you are considering a career in neuropathology or you're interested in forensics. The last pathway is available only at a few programs, and it is the physician scientist pathway, in which you start your residency as an APCP resident. Then, after your first year, you take 1 or 2 years dedicated to research, and then you continue your residency. Here are some of the tips shared by practicing pathologists on Twitter with the hashtag PGY1 Advice. I endorse all of these, and these would be very helpful during your first year and beyond. I mentioned earlier about books when you start your anatomic pathology rotations. These books are written for junior residents and they will reacquaint you with histology and common diagnoses. My advice is to start off with histology for pathologists and then go to Malawi and then further on. In addition to the books that I mentioned, there are apps and websites which you can use to familiarize yourself with particular subspecialties. I have mentioned Path Elective for autopsy and micro, and I think those modules are a very good starting point. If you have an iPad, you can download these wonderful atlases from Johns Hopkins, focusing on surgical and cytopathology. I have also uploaded a file called Educational Resources on the page that has a lot of useful websites and resources that you can use throughout your residency. At most programs, there are also resident libraries with both physical and digital resources to be utilized. In conclusion, I would like to say that when you're starting your residency, there are certain things that you will be focusing more on, and sometimes they come at a cost. And I feel like you should try to try to focus some time on things that really matter to you. For example, it could be family, it could be exercise, it could be meditation, like whatever is you think is the most important part of your life, so that you do not become your work. And the goal is to be an effective pathology resident and also a good human being. I would like to thank some of my friends and former residents that I trained with who helped me compile this list. And that is all for this presentation. Thank you.